So I just want to say one thing, first of all, that I maybe the title of my presentation when I submitted it is a bit misleading, and what I'm really going to talk today is about the experience and the needs of gay men newly diagnosed with HIV in the context of the study that we did. And I just want to say also a little bit of a disclaimer to remove some of the pressure on me, I guess. But this is very preliminary analysis that we have done, and I'm just trying still to try to make sense of the data that I'm going to talk today. So I think I see being here today as a bit of an exercise to try to kind of get a sense of what I'm talking about, I guess. So just to give a context of the study, so we conducted research with HIV-positive gay men to try to understand what were their needs at time of diagnosis. And that was to help us in the context of the study that Michael talked about to try to inform the development of an intervention for newly diagnosed gay men with acute HIV. And the idea of interviewing gay men with HIV came out of a first set of interview that we did with professionals, and among the professional, which was like different professional nurses, doctor, community counselor, and what was very key that came out of it is that there was some professionals that were also HIV positive gay men, and their discourse was so different than the other professional. So that gave us an insight that, okay, now maybe the counselor, maybe the professional have a different view than actually gay men. So we went and interviewed gay men. As I said, in the context of our study, we interviewed 20 positive gay men. So we did some recruitment through different venues, community group. We had an ad at Little Sisters, different place. And also we had an ad on squirt.org and other website. So gay men that were HIV positive that have been diagnosed after 2000 that identify as gay or MSM and comprehend English were invited to contact us for an interview. And at the beginning, we put the date to 2005, but we have very little participants, so we push it to 2000. And why we didn't interview people that were diagnosed prior to that is that we were afraid that people will have there would be too much recall bias to people, and also because, you know, everything is always changing, the services, but also, like, you know, the treatment is changing. So we, you know, the experience of people being diagnosed today is probably different than someone that was diagnosed, you know, in the 90s. So this is a bit of a sample of our participants. So we had 20 participants in Metro Vancouver. I just want to say that we did also, thanks to Captain, 3 interviews in Victoria, but we have yet to look at those interviews. And people were diagnosed between 2000 and 2008. So we had a big age range from 23 to 58, with the average age to be 42. And also we had a great group, quite diverse in terms of ethnicities. And just to kind of give you the 4 people that were from mixed ethnicities were a bit of a mix of, were all Aboriginal and Caucasian, so quite a high representation of people from Aboriginal descent. And I think that's going to be the only reason I can explain that is that I think one of the staff of one of the ASO that deal with Aboriginal people got very excited about the study and became a big promoter for us. Thanks to her. So just to talk about, so right now I'm going to go through some of the theme and the quote, and here's a quote that, it's a bit here for me to read and speak in the mic, but here's a quote about someone when he received his diagnosis. Have you ever seen a television commercial where a woman goes in to see the doctor and he says, "I'm afraid you have cancer," and the doctor goes on, and all of a sudden you don't hear him anymore, the audio just go out. It's sort of like that. It really is. I'm not certain what my doctor said. All I heard was that I was HIV positive and I don't have Hep C. And that was a very common theme among our participants, that they felt like I was asking them, like, what do you remember what the doctor says? And all they were like, the only thing I can remember is the diagnoses. So that was very common among the participants, this kind of experience. And I'm sure people like know what the commercial, I don't watch that much TV, and I know the commercial that this participant is making reference to. So very similarly, this is another fellow I just went blank. Everything just went blank. I actually had my car parked in the parking lot, and I took the bus to go back home. So just to tell in which state of mind I was, the doctor told me to contact St. Paul Hospital, and I had to change my doctor. It was very cold and very short. And what I want to point out here, again, the idea that it was blank, but I think it reflects another reality that there's very little. The participant felt that there was very little support that we're giving to them, and the psychosocial need were not being addressed in the post-test counseling. And most of the time, the only thing that was kind of addressed was being like, you know, you need to find a doctor, or, you know, we need to do some medical follow-up with you. And I want to point out to also that it seems that this was the fact that the psychosocial needs were not addressed seems to have been more common among participants that receive a diagnosis from a doctor, which was their family doctor. That was more common than people that got diagnosed by a nurse. So obviously, people, when they have a HIV diagnosis, they go through a lot of experience, and I think it was quite varied, what people were feeling, from guilt, denial, anger. But I think one of the things that came out a lot is there was really people felt they have lost something, and that was described either two ways. People felt they had lost control, or either they have lost their health. And here's two quotes. I remember just thinking, I got this thing inside of me, and I can't get it out. I had to mourn the loss of the normal, healthy person that I was, and now I've got this thing inside of me. There was so many things and here's another quote. There were so many things that I started bubbling up to the surface. I knew I wasn't in control anymore, and I think that's the most important thing. I had lost control of my life. Something else was going to be in control now, and it wasn't me. So that was very common among the theme. Most participants felt they have lost control, found they lost their health, and this was really not addressed in terms of the medical care. And actually, I think the loss of control was compounded by the fact that people felt they didn't really understand the medical process that were happening. People were doing tests on them. They didn't really know what it was. They were not informed if they needed to start medication or not. So, yeah. So we asked people what they felt they needed at the time, and I think it was very clear that what the people felt was what they really needed was emotional support, and that's probably not a surprise to you. So here's some quote. I would have liked counseling, just somebody to talk about things on it, and someone referring about the emotional level. There was nothing there. And here's another quote. When you find these results, you get really depressed. You need attention from someone close to you. So really, those people felt they were connected to medical care, and it was that, but really nobody was making the connection to help them to be referred to services that provide emotional support. So that was very clear that people wanted someone to talk to. And when I asked them, like, well, who do you want to talk to? And here's a description from a fellow. Oh, no, that's still on emotional support, I think. There's really not a lot of help a person deal with specifically what they're going through after being diagnosed. I can get medical support with my doctor. I can get physical support at that time with my partner who helped me through my illness. But there's just a total lack of emotional support at the time. I still think there's a level of emotional support missing. So this person said, you know, I had my doctor, my medical need were met. I had my partner who was taking care of me, like, you know, you say physical support, you know, he was sick at the time. So, you know, like making like soup and cleaning his apartment and that kind of thing, but really he didn't receive the emotional support. So I say, sorry, to come back to who to talk to, here's a quote from a participant that really reflects what a lot of participants says. It's very different when you tell someone who's HIV negative that you're HIV positive than telling someone who's HIV positive that you're HIV positive. It's a very different thing. It's like if you're recently widowed talking to another widow. They have an idea of what you're going through, as opposed to someone who has no idea what you're going through, what's going on with you emotionally, what's down the road, and all that stuff. That became very key, that people really wanted to talk to someone who was also HIV positive, and a real feeling that, you know, only another HIV positive person could truly understand what they were going through. And I think also, as the future seemed very uncertain, people have lost control of their life, they lost control over their health, and as like, you know, they're not sure what the future will look like as them living being HIV positive, they really see that talking with another person could really provide insight to them and what the future is gonna look like. And that became very key, I think, and for many people. So here's a quote from someone who saw a psychiatrist, and I just want to, I meant to mention earlier that only 2 people in our interview actually saw professional counselors, and one of them is because he attempted suicide, and the other person has a very serious thought of suicide. So that was the only time where people actually seek professional counseling. And here's a quote about someone. The first quote is reflecting to someone that actually saw a psychiatrist who was a heterosexual female. Well, actually, he assumed she was heterosexual, and he felt there was so much pressure on him to try to educate that person about A, what was it of being gay, and B, what was it for him to be for someone to be HIV positive. So there was a lot of pressure, and that actually, I think, he felt that really had impacted on his therapy. And the other one is a quote, and that was not as strong as being HIV positive, but there was a lot of sense for people that also, if they're gay men, they wanted to talk to someone who was HIV positive, but a majority also wanted to talk to a gay man, and that didn't came as strong. And I think for a lot of people, they didn't feel comfortable saying that. And for example, and I think it's because they felt we try to be always politically correct. And I think for an example, one of the participants said, "Oh, I would have been fine talking to anyone, but I would have liked the person to have been infected the same way I did." And I was like, "What do you mean?" "Well, by having sex with another man." So, it was a bit contradictory. And also one of the participants felt that one of the participants say would have been more comfortable to talk to a woman, and it's because he had some, not issue with his gender identity, but he identified more being a female, and he was very feminine, and so he felt he would have connected better with a female. And also some of the people had, at time of diagnosis also, a lot of stigma related to homosexuality may have come up for them, and I felt some people were very angry at the gay community and were maybe not ready to talk to another gay man, but would have liked to talk to someone who's HIV positive. So I just want to assess one other thing, and this is, this is not my, I want to disclaim this is not my thought, but it seems there was a lot of barrier to access AIDS service organization, and one of the biggest barriers, people felt they were not made aware of what the services were. Sometimes the doctor or the nurses would mention after that, maybe you want to check out BCPWA, but people, where are they? Where's the number? What is their services? This connection was really not being made. And also there was a few complaints about the application process to be a bit difficult and demanding for people, like having to fill out application, bringing them to their doctor, and if you want to join 3 different organizations, they have 3 different forms. And this is not my thought, but talking about social determinants yesterday with Verlatte's presentation and talking about physical environment, there was kind of a sense that those spaces were not always safe or respect the dignity of gay men. And this is some quote from participant. "The first time I went there, I had the impression of walking into a drug addict clinic." So referring that, it felt like I had a gay man, I didn't feel safe because people were maybe not of the same social status of me, or may have different issues. And the other one, well, I remember walking there and just the smell of the place. I was disgusted by the smell of the place. Everything was kind of falling apart, and that came out yesterday in one of the breakout sessions. And this is the perception of the person, but also I think it's probably a reflection of how do we maintain those space, and how important physical spaces is to gay men. So one of the very exciting thing that came out of our thing is the importance of knowing HIV positive gay men at time of diagnosis, and for the people that had friends that were HIV positive prior to getting tested and getting their result, deal much more better with their diagnoses. it reduced stigma, it reduced their anxiety, and it led them for services. So I'm just going to read some of the quote very quickly. One of it was, a friend of mine was HIV positive and volunteer, kind of grabbed me by the end and pushed me towards AIDS organization and encouraged me to join, which I did. So this one, I had a friend of him coming with him and, kind of going through the barrier. So I've been exposed to HIV positive guys for a long time. I basically got everything I needed from them. And this is someone that didn't have that and said, I wish I had someone there who was HIV positive, who's been through this before, like a big brother. And that really came out a lot in some of the interviews. So I'm kind of running out of time. So in summary, well, HIV diagnosis is a very traumatic event. We keep talking that HIV is a chronic disease, but in terms of there's very serious psychosocial impact that really was covered with those men. And I just so here's some of the things I already talked about. But one of my big questions, I haven't done those interviews, and I'm gonna skip one of the interesting slide that I had, but what should really be the focus? What do gay men really need to cope with their HIV diagnosis? And when gay men, because at the beginning my impression was like, gay men are keep telling me they want to talk to other guys, so I felt like, oh, they want to have peer counseling, But right now I'm kind of looking at the data, I'm like, do they need counseling? Do they want peer counseling? Or are they telling me that they need support network with other HIV positive gay guys? Or do they need both, and are those two things different? So this is some question that I'm asking myself right now with looking at those data. So just some acknowledgement. I just want to acknowledge Malcolm for being one co-investigator with me on this study and participating in the interviews. Justin, who did an amazing job at recruiting participants and transcribing interviews and providing some insight into the research. Captain for conducting the interview in Victoria, and that's going to be very exciting because I didn't talk about, I had to skip some of the barrier, but one of the barriers for people living in Metro Vancouver was that the services were downtown. So can you imagine someone that lives outside of Metro Vancouver? And the CISR study team, many members are there here. Some of them were just for moral support, but just supporting me. And just last thing I want to say, I know I'm out of time, but thank you so much for the study participant who've provided me insight about their story. And that really changed myself professionally and personally. And I just want to say something that someone told me off the record. And this guy, I did the interview with him, turned off the recorder, and he told me thank you. And I was like, well, thanks to you. And he's like, no, I really I mean, thank you. This was like really a good experience for me. I was like, oh, thank you. He's like, I've been diagnosed 4 years ago, and you're the first person who ever asked me how it felt to become HIV positive. And every time I think about this story, I'm like, that was, that just kind of shows the lack of psychosocial support I think that HIV positive gay men receive at time of diagnosis. Thank you, everyone.